Hello out there, Facebook world. I want to introduce you to somebody who's working very hard, even though she's working from home. This is Lisa Hartstein, the Director of Programs for Promise Fund of Florida. And want to say good morning to you. Thanks for hanging out with us for a minute, Lisa.
Thank you, Ashleigh, for being here with me this morning.
Great. Well, so for people, first of all, who are not familiar with the Promise Fund, tell us what you aim to do in our communities.
The Promise Fund was formed 2 years ago, and we have a very specific mission. We help women that have no access to health insurance, and our focus is on preventing late stage deaths due to cancer, for cervical cancer and breast cancer. And those are our intention is to promote early detection screening so that cancers are found in the early stage where they're more and they have better health outcomes.
Yes. Oh my gosh. And I know everybody has their mind on so many things, but talk to us about this. Why is it so important for women to seek treatment and get checked? Why is time so important in this particular battle against breast or ovarian cancer, cervical cancer, any of those types of things? Why not wait?
Well, it's very important, and any period of time, including right now, while we're going through the COVID-19 pandemic, that cancer can't wait. And so when we find anything that's abnormal in our body, it's very important to seek those healthcare resources immediately, because the earlier, as I said before, the earlier you can find something that's wrong with you, then it's more treatable. You have options. So if you find something quicker and early on, then you can maybe avoid chemotherapy or radiation. You can have surgery, or you maybe you won't even need surgery. Maybe there will be some type of medicine that you can take. So there's many more options and that have fewer side effects.
Okay, so definitely, well, even though it's not a convenient time to be thinking about all of this, it's definitely not something to ignore. So talk to us. I mean, we all should be doing breast self-exams, for example, at home. Talk to us about some of the things that we might say, goodness, this is abnormal. So something's not right. I should potentially be seeking some help.
Right. So in our areas with preventing cervical cancer, it's really important if someone finds that post-menopause that they have bleeding, or before menopause if their menstrual cycle is very different, or if they have pain in the unusual pain, or there's a myriad of reasons that could cause cervical or breast cancer. With breast, specifically if you feel something unusual in your breast, or if there's heat or rash or nipple discharge that's not normal, not typical, you're not lactating, that basically any kind of symptom that's not normal for you, you need to immediately get in touch with a doctor. Now, if you don't have a doctor, that's where the Promise Fund, if you don't have a medical home, that's the important service that we provide, is because the Promise Fund funds navigators in our community that a woman can call if she doesn't have health insurance and she doesn't have resources. And especially now with a lot of people out of work and they may have lost health care, it's really, really important to know you are not alone. If you do not have, again, a doctor or someone to call, our navigators are available. We have 3 organizations that provide that service. It's Marie Louise Cancer Foundation, Found Care, and Morris Life Health System. And their phone numbers are located on our website.
And this is really neat. I've done a story. I've put the link into this Facebook post, but did a story last year to kind of explain the nuts and bolts of this. The navigators are really interesting. I think this is the kind of thing that really any type of healthcare field would benefit from, because when you enter into a world of any health concern, breast cancer, for example, and you say, oh no, it's like this enormous education that you never wanted to have, but you're starting from scratch. And so tell us about the navigator, how they help to guide people, right? And this is something that's even available right now in the time of coronavirus.
Where the navigators are very important resources in Palm Beach County for women. And the reason that is the case is because they're like your own fairy godmother in a sense, because they're your personal advocate for your health care, and they either help you with obtaining a screening, a screening mammogram, which you may have never have had because you haven't had money to get one. They explain the process of every step of the way, whether it's a screening, a test, whether it's a diagnostic, and then if you have cancer, then the navigator, if you don't have transportation, the navigator will help arrange that, or even take you yourself, to the medical appointment, and the navigator will provide translation in Creole or in Spanish. So that's very important. But the most important thing is something we call health literacy. Not everybody is a doctor, and not everybody understands the terminology that surrounds the women's health care or cancer specifically. And that's where the navigator comes in. She is basically your conduit to getting great health care and making sure that you're healthy and well for yourself, for your family, for being in the community, for being at work, for all aspects of your life.
Yeah, and you really are helping in long term, trying to break down some of those barriers that may be between somebody, like you mentioned, transportation, childcare. I mean, and things are really complicated right now, especially with all that we have going on in our lives and our employment and all of that. But it's nice to know that something is available. How is the best way for people to get in touch with you? Is it so we should go to the website if somebody's concerned and they want some help? Go to the website first.
Yes, and the website is www.promisefundofflorida.org.
Very good. What else do you want us to know? You personally, you've really felt good about your time with Promise Fund and what you've all been able to do, especially in this time so challenging.
Okay, there are several things I would like to convey. The first and most important is everyone is concerned if they leave the house, could they contract the COVID-19 virus? Now, obviously, there's risk. Everyone is aware of that. But the healthcare facilities that our navigators would be directing people for care, they are all taking the necessary precautions. They are ensuring the safety of their healthcare workers and the safety of all the patients. So we don't want anyone to be afraid to call a navigator and to reach out for help because they're afraid for their own health when they leave the house. So that is something that our community health partners are very much on top of. The other thing I would like to say is for people with cancer, it's a very challenging time. People need this information, need to find out if they have cancer, and if they do, then they have to talk with their doctors because they have to make decisions as to when to start treatment, what's the most effective treatment. And I can tell you that our navigators are, the people are facing, tough challenges. One of our navigators has a 27-year-old woman who has cancer, and she would like to, freeze her eggs. And because of COVID-19, the process of submitting, the application for financial assistance and all the things the navigator helps people with getting financial assistance and getting health insurance when possible, all of those things are slowed down. So for people with cancer right now, we are doing everything we can to support them in their journey. And also what I would like to say related to the innovative strategy of the Promise Fund is that we are building in Palm Beach County a continuum of care for women who, again, have limited resources so that they don't have to have delayed access to screening, diagnostic, and treatment resources. And we are very excited about this model that we are building. We have a commitment from Hologic for a potential installment of a 3D mammography unit. And that's going to help us launch this continuum of care model. And we're very excited for that to happen this coming fall.
Oh, that would be wonderfully exciting, especially some wonderful news at the end of all of this, and just to continue that mission. We want to say thank you so much, and thank you for providing the service. And just for the women out there, again, if you're suspecting that something's going on with your health, even though it's a stressful time, there's a lot happening, don't ignore that. Make sure that you take care of yourself. Reach out to the Promise Fund. Reach out to a healthcare provider. Make sure that you're getting what you need.
Absolutely.
All right. Thanks a lot. Bye-bye,
Lisa. You're welcome. Bye.